I am so sorry that this was your experience with the transvaginal ultrasound probe. I wanted to come on here and talk a little bit about doing a transvaginal ultrasound so that if people are having this exam scheduled and they're really anxious about it, maybe this can help a little bit, allay your fears and make the most of the situation. So this is a transvaginal ultrasound wand. It looks really intimidating because it's quite large. However, only about this much of it ends up going inside the vagina. The rest of it is just long because we need to be able to turn to be able to see what we need to see during your scan. Typically the probe will be covered with a condom and some gel to make it less uncomfortable for you, although this can be uncomfortable still and sometimes painful for people who have things like vaginismus, endometriosis, ovarian cysts, or a history of trauma. There are some things that you might be able to do to make it a less uncomfortable experience, and one would be emptying your bladder. You want to actually have an empty bladder for the transvaginal ultrasound. If you're doing a transabdominal ultrasound first and you need a full bladder for that, ask if you can empty your bladder in between, because a full bladder can make it more uncomfortable. Second, you can control the placement of the probe if you want. If you're not uncomfortable with that and you're worried that it might be painful to insert the wand, you can control it either by guiding your doctor's hand or asking to place the probe yourself and then letting the doctor take over once you are a little bit more comfortable. Third, if you have a history of trauma or if you've had one of these scans and had a bad experience in the past, you can always ask for Valium or another anxiety medication to relax you prior to the procedure. I do that for patients that have a history of trauma or just asking for it given that they have a history of pelvic floor dysfunction or vaginismus to make their experience a little bit less uncomfortable for them. Finally, you can always decline having a vaginal ultrasound, so you can always ask for a transabdominal ultrasound instead. Sometimes we are unable to see well with a transabdominal scan, just given that the ovaries are small and they're deep in the pelvis. However, it is always your decision and your right to say no if you don't want to do the transvaginal scan.